All right, good afternoon, everyone, and good day to those who are not probably listening to us from Nigeria. I want to appreciate MDoc for inviting me to speak on something I'm actually pretty passionate about, and I hope would have a nice time having this conversation today. So I'll be using this outline um, to have this conversation today with us. And I would like it to be as interactive as possible. Um, and I hope we have a nice time while we learn. So, cervical cancer is a preventable and potentially curable cancer that develops in the cervix. And for those who are not doctors or health workers um, on this conversation. The cervix is the opening of the womb. It's like 3 to 4 centimeters long, and for the doctors, it happens in the cervix. The cervix is in the transformation zone of the cervix, and it's caused by persistent HPV infection. HPV is human papilloma virus, and we have the highly oncogenic ones. Where 16 and 18, the oncogenic type 16 and 18 causes the highest rates of cervical cancer. We have about 75% of the cases of cervical cancer that are caused by these oncogenic types. And it's one of the leading cause of cancer-related deaths amongst women, especially in countries like Nigeria, that is the low and middle income countries. And one of the reasons why I'm pretty passionate about cervical cancer is that early detection, HPV vaccination, and doing one or two other things, concerted efforts, can eliminate cervical cancer. And it's one of those cancers that has been earmarked for elimination by WHO. And WHO is targeting that by 2030, some countries would have reached that level to eliminate cervical cancer. And every 2 minutes, one woman dies from cervical cancer. So um, I'm going to be speaking for roughly 20, 25 minutes. And that means 12 women would have died worldwide in the course of this conversation. And that is how crazy um, cervical cancer is. And it's the fourth commonest cancers amongst women worldwide, with breast cancer being like the most common cancer in women. And 90% of deaths occur in low and middle income countries like Nigeria because of our attitude towards prevention. And in Nigeria, it's the second commonest cancer in women. And we have 8,000 deaths occurring from cervical cancer yearly, with 12,000 new cases diagnosed. And this is just like a tip of the iceberg. It's just the figures that we have, because a lot of people who die from cervical cancer or who have cervical cancer do not even present in the hospital. Just imagine a woman in a rural area who is bleeding abnormally. She probably think that what is causing this for her is some mystical powers that is leading to this. So these figures that we have are even lower than the real figures that actually exist among our women. So let's talk briefly about the signs and symptoms of cervical cancer. At the early stages, cervical cancer does not present with any um, symptom or sign. It happens, starts from like the persistent HPV infection, now leads to a change in the cervix, which you call cervical dysplasia, which is the precancerous lesion, which now progresses into the invasive or the cancer itself. So in the early stages, there's no symptoms. It's just normal. It's just like there's nothing happening to this woman. But then when it now becomes late, when it enters into the late stages, you have things like abnormal vaginal delivery, abnormal vaginal bleeding, unusual discharge, and this discharge is usually foul smelling, just like it smells like probably like a dead corpse. If you have perceived maybe a chicken that has died before, and it's probably behind your house, and you're just wondering what is dying here, or maybe a dead rat. So that's how the discharge is. Then when there is metastasis, there could be pelvic pain because there's metastasis to the bone and some other structures down there. And then women could have intermenstrual bleed, or they could have bleeding while they are having sex, and heavier than normal vaginal bleeding, which people would think, oh, this is probably just normal, can also occur. So at the late stages, we have a lot of symptoms that ranges from lower back pain to swelling of the legs and difficulty in urinating, all because there's a metastasis. Because when we talk about cancer, it's an abnormal growth of cells in the body, and then these cells just go to places where they are not supposed to go to, and then they start causing problems there. So let's talk about how to prevent. And let me just add that in the run up to this conversation, I really did not want to talk about the symptoms of cervical cancer. And this is the reason, because I basically do not want any woman to experience the symptoms. I know it's right to always talk about symptoms, but I believe that those who are here, who are having the conversation with us, have not had the symptom, and or probably are just my thoughts. And it's a cancer that can be prevented at different levels, like we'll see now. And if it is caught early, there's treatment for it. And it's pretty disheartening that women actually die from this cancer, because it's something that's not supposed to happen. And people might think that this thing that I'm saying is far-fetched, but we have countries like Australia, New Zealand, the UK, that have considerably reduced the number of cancer and cervical cancer deaths in their midst. A country like Australia has not had cervical cancer in years, like a diagnosed case of cervical cancer in years, except for probably those who come into their country. And even if you come into the country, you will do your cervical cancer screening. So these are some of the things that we are going to talk about in this prevention that we are going into now. So we have several levels of prevention. We have the primordial, the primary, secondary, and the tertiary. And then they mean different things. I saw in the quiz that there was quaternary level of prevention. Yes, there's actually quaternary level of prevention, but we've not gotten there. Quaternary level of prevention is prevention of over-treatment of a particular disease. But in Nigeria, we've not even undertreated. Not to now talk about, we are still on the level of undertreating, not to talk about over-treatment. So quaternary is under-treatment. And then we have quinary. Quinary now talks about working on misinformation and some other things. So primordial prevention is working on policies and laws for cervical cancer prevention. So for instance, in Nigeria now, every girl between the ages of 9 and 14 should have the HPV vaccine for free. So that is a policy, and that is working for Nigeria already. The country is also working on a policy for cervical cancer screening. And at the moment, there is really no strict policy for saying, okay, every woman should have the cervical cancer screening. But in countries like the UK and Australia, any woman who is at the age of 21 must do her first cervical cancer screening. And if you get into such countries, you get a mail from your general practitioner telling you to go and get your cervical cancer screening done. That is a policy that they have done. And those are some of the laws that they have on the ground in those countries. But in Nigeria, so far now, the policy that we have basically is for girls to get their vaccines between the ages of 9 and 14 in any primary healthcare center, which was launched in 2023 for, I think, October 2023 for girls in Nigeria. It was done in 2 phases. The first phase was in October, and the second phase was like around the first quarter of 2024. And now it is domiciled in every primary healthcare center that young girls should get these vaccines. Older women can also get the vaccines up to the age of 45, according to the American Cancer Society. A woman up to the age of 45 can get the vaccine. So some would say people who are sexually active shouldn't get it, but there are people who are of the opinion that if you have not come in contact with the virus, so why not get the vaccine? So this leads us to primary prevention. I've talked about the HPV vaccination, that we have a policy in Nigeria for that. And We have different types of the HPV vaccines. We have the Cervarix, we have the Gardasil. Cervarix is the bivalent, which contains 16 and 18, while Gardasil 4 and Gardasil 9 contains other strains of the virus to protect women from having other oncogenic strains. But all the three vaccines, the Gardasil, the Cervarix, and Gardasil 9, Gardasil 4, and Cervarix, all of them contain the strain 16 and 18. And there are studies that have shown that these vaccines actually have cross protection. So even if you have taken Gardasil, if you have taken Cervarix, that is 16 and 18, then it can cross protect against other oncogenic strains of the virus. So about the HPV vaccination also, the schedule is currently the schedule we are using for the national vaccination for the girls is just one dose, because there are studies, systematic reviews that have shown that just one dose of the vaccine can actually prevent against the cancer. But there are other schedules. You can either take the first dose and take one dose 6 months later, or you take one dose, the zero dose, you take another dose after 1 month, and then you take another dose after 6 months. So, but there are studies that have shown that one dose is enough, where, however, follow-ups are being done on these studies. And in the UK, there was a study that was done following up people who have gotten the vaccine, and over the years, I think 99.9% of those people, I think over 90% of those people have been followed up, and none of them has had cervical cancer up till now. So it shows that the vaccine is safe, it's effective, and it is one of the major things that we need to focus on when we want to talk about the prevention of cervical cancer. Others are safe sexual practices, condom use. Condom use is not really 100% protective against cervical cancer, because the virus is not found in the semen or the body fluids. It's found on the skin and the mucosal membrane. So it's very important that when you are trying to protect for cervical cancer and you are using condom, proper use of condom should be what we should do. Reducing multiple sexual partners. I don't know how we are going to do that, but multiple sexual partners is actually one of the risk factors against cervical cancer. And also smoking cessation, stopping smoking is actually supposed to be one of those things also that we need to talk about. And health education and awareness, this is part of what we're doing, because what people don't know about, they won't be able to prevent it. Behaviors that they do not know about, they would not be able to adopt them. So health education and awareness is very important. And for everybody who is on this call, I think at the moment we have about 64 people on the call now. It's important that you become an advocate. So if each of the 64 people on this call talk to 10 people, that means 640 people would have heard about cervical cancer. And I think you can do a lot better than that. Maybe on your WhatsApp status, you can just put it there that have you heard of cervical cancer? And it probably will reach 100 people. So if each of us can reach 100 people, that means we would have reached about 60,000 people. So that is how powerful health education and awareness can actually be. So we go talk about secondary prevention, which is about screening, early detection, and prompt treatment. And there are different types of screenings. We have the HPV DNA testing, which is the gold standard, followed by Pap smear and VIA. HPV DNA testing is done every 5 years. VIA and Pap smear is done every 3 years. But for people who have HIV and other immunosuppressed suppressed states, the screening gap is actually pretty closer. It's yearly for those who are living with HIV, or 2 yearly, according to how it's prescribed by their doctors. And also for the vaccination, let me just backtrack that for the vaccination, those who are living with HIV or who have immunosuppressed states should actually take the 3 course doses. That is what is still recommended by WHO. That's the 0, 1, and 6 months course of the HPV vaccine. And after screening is being done, you don't just leave women that you find who are positive. Okay, you have cervical dysplasia. There are different treatments available. We have cryotherapy, lip excision, thermocoagulation, and for some people, they will definitely require surgery. For instance, those who have completed their family size, you can just tell them, please do hysterectomy, so that we won't have to bother and think about screening again for you. although those also come with their own challenges, but then when the benefit outweighs the risk, we go with the benefits of it. So tertiary prevention is managing disability and ensuring that those who have the disease do not live with debilitating conditions all through their lives. And that is to ensure that prompt diagnosis is done for them, and then they get maybe chemo, radiotherapy, and support care for those who probably are in the late stages, which probably we call the palliative stage at that level. And one thing about cervical cancer basically is that if it is caught at the early stages, even up to stage 2A of the cervical cancer, people can actually get cure for it. So when we're talking about the global strategy for cervical cancer prevention, WHO has set a global strategy that by 2030, cervical cancer should be eliminated. And how do they want to do it? How are they proposing that we should go about it? 90% of girls who are eligible should get their vaccines. And that is one of the things that we are doing in Nigeria now. 70% of women of reproductive age should get screened at least twice in their lifetime. And then 90% of women should receive treatment after they have been screened if they are found to be positive. So that is what we call the 90-70-90 target of the World Health Organization. And Nigeria is a lot behind, especially in the 70 and the 90. In this 90, well, we're doing a little well. Vaccine coverage is still low. We have about 7 million of girls between the ages of 9 and 14 who were able to get the vaccine in the last rollout. And we are still monitoring the situation to see how that goes, because at that particular point in time, they were doing fixed posts, mobile posts for the vaccines, but now it's domiciled in the primary healthcare centers and government hospitals, and people have to go and access the vaccines by themselves. So we are monitoring the situation to see how it's going, but I don't think Nigeria can achieve the 2030 target. We could probably do a 2040 if we are very, very serious about what we want to do. But I don't think 2030 is just 5 years from now, except we do some very radical work against cervical cancer in Nigeria. I don't see us achieving the 2030 target, but at least we can make some meaningful goal, some meaningful stride towards that. In Nigeria, what have we done so far? NICRAT, that is the National Institute for Cancer and Research Treatment, is in charge of research and policy on cervical cancer, or not just cervical cancer, but on cancer. But at the moment, we have like a 7-man team headed by Professor I.F. Adewale, a renowned gynecologist, the former Minister of Health of the Federal Republic of Nigeria, leading a 7-man team to develop a policy for Nigerian cervical cancer. HPV vaccination rollout was also done. I'd spoken about that. And then FLAC clinics for both breast and cervical cancer. That's First Ladies Against Cancer. This is supported by Roche Foundation. And then Nigeria Cancer Fund, which supports people who have both breast, cervical, and prostate cancers in Nigeria. So that's what Nigeria has done. So I currently lead an organization that works on cervical cancer and what have we done so far. My organization works on outreach, like awareness, ensuring that there's early detection. We use mobile clinics, set up permanent screening centers, and so far, more than 8,000 women have benefited from our treatments, gotten HPV vaccines delivered to about 500 women, wherever they might be. And we have trained quite a number of personnel. Close to 1,200 personnel have been trained by our organization, ensuring that they have the knowledge, and we expand the number of people who do cervical cancer screening. And we don't stop there. We also do advocacy and also ensure that women get to know about this cervical cancer. You'd be surprised that educated people. I was in Montreal last year, and I was talking to somebody who is an accountant, and she was asking me, where is the cervix in the body? And honestly, I was shocked, but I could not express my shock. I just had to explain. So you would see people who have smartphones. A lot of people ask me, on Twitter that what is cervical cancer. So you just assume that quite a number of people know it, but advocacy is actually one of the biggest work that we should do. And my organization has actually also collaborated with other organizations like the Amen Foundation and the Gombe State government to develop cervical cancer screening centers in all the local government areas of Gombe State. We screened over 20,000 women in 5 years, and this is like one of the best cervical cancer screening initiative. I think I'm being modest by saying in northern Nigeria, but yes, in Nigeria, because it's still standing. This is the 5th year of the program going on. So we have screening centers in all the local government area and like a flagship center, like a center of excellence in the State Specialist Hospital in Gombe. Our referral system is superb, back and forth, and you get your feedback. And each woman we ensure that no woman is actually lost to follow up. We involve the community leaders, the nurses screen. We have community mobilizers that are trained to go and bring people in from the communities. And this has actually been pretty working so well in the States. All the centers are equipped with cryotherapy machines. And in the referral center, they have LEAP, they have thermocoagulation, and they are equipped to actually do surgery. And this initiative is led by nurses. And that is one of the sweetest parts of it. Retired nurses who probably would not have anything to do at home. So why not? Let's engage their services, and they are doing pretty well in those places. So how can we have like a collective action to eradicate cervical cancer? And this role, this responsibility is not just for the government alone, because when we say how do we collaborate, the first thing that comes to an average Nigerian's mind is, oh, the government is not doing enough. But as an individual, what exactly are we doing to ensure that cervical cancer is prevented? So on the individual level, everybody should ensure that they do their cervical cancer screening, get the HPV vaccine for your daughters, raise awareness. The awareness is not supposed to be for NGOs or the government alone. Individuals too should raise awareness and talk to people about this HPV infection, how it leads to cervical cancer, and how it can be prevented at different levels. And then, yes, the government is central to it. That is why they are in the middle here. They should ensure that the policies they make work, because we have quite a number of policies in Nigeria that are not working. We should ensure that the HPV vaccine are free or subsidized. Now, it's free for girls between the ages of 9 and 14, but we can actually still make it cheaper for people who are older. Also, we should integrate cervical cancer screening into primary health care, which was what we did in Gombe to ensure that, yes, the first contact, because a lot of people, when they hear primary health care, they think it's for poor people. But primary health care, in the real sense of it, is supposed to be the first contact for people who are going to come into healthcare. Train more health professionals, ensure that every healthcare professional, every hospital has somebody that knows how to do cervical cancer, and to strengthen our cancer screening treatment in Nigeria, which is pretty weak at the moment. The role of the private and non-governmental organization to ensure that we expand our awareness campaign, support mobile clinics in rural areas, partner with the government, and let me just chip this in for the health workers who are on this space, that the sector-wide approach of the government is actually something that we all who are working in cervical cancer screening space should key into, or even into any space, because we shouldn't have bits and bits of efforts everywhere. We should have a concerted effort, an effort that is put together. Everybody comes together and let us see how we are going to be able to achieve this. Not that we are putting bits and bits of resources in different places and we are just achieving like tiny little bits of results. And one thing that I usually love to say is that I love to collaborate. My organization collaborates with lots of organizations when it comes to cervical cancer. I say that I can't eradicate cervical cancer alone in Nigeria, and my organization cannot screen all the women in Nigeria. But when it comes to collaboration, that is the new competition, and that is what every stakeholder should work on. And that's why I'm really in love with the sector-wide approach that this current administration is trying to work on. think that would really work. Everybody should come under one umbrella and distribute resources for, in this context, cervical cancer equitably. So challenges of cervical cancer screening in Nigeria. We have plenty of challenges in Nigeria. Challenges plenty. And these are the challenges. And these are not new things to us. But about our poor data and surveillance, our cancer registry is really not doing very well. And I think that every stakeholder should look into ensuring that we have data, because once you have data, implementation of programs and every other thing will be very easy to go about. So, but you can still see other challenges that we have. I just wrote 8 challenges here. We have more than 100 challenges in Nigeria when it comes to cervical cancer. Then my recommendations will be for us to do the following: increase awareness, strengthen screening, subsidize screening and treatment. Should we subsidize it or should we even make it free? Address stigma and cultural bias, enhance policy implementation and funding, and improve data collection and surveillance. This is pretty important also. We should actively do that number 8. So in conclusion, cervical cancer is preventable, and the collective effort from individuals, government, and private organizations is crucial to achieving a cervical cancer-free Nigeria. Thank you for having me. I hope I did not bore you. Questions?
Thank you so much for that wonderful presentation. I was not bored, so I don't know about the others. It was really insightful. Thank you so much for highlighting this. I think one part that really caught my attention was when you said by the end of this session, so many people would have already died of cervical cancer, which is really, really sad given that it is preventable. So we're just going to go into our question and answer session. Please, if you want to ask your question, you can raise your hand and we'll unmute you and you speak. If not, you can put your questions in the chat so that Dr. Babatunde is here to answer everything, right? Every question that you have, so that we will be armed to help fight this cervical cancer, help prevent it for ourselves and family, and also help fight it for others. So we have one question in the chat already. Dr. Babatunde, this question is for you. So how were you able to get 20,000 women vaccinated in the northern part of Nigeria, considering the religious peculiarities?
Okay, more than 20,000 women are vaccinated in northern Nigeria now. More than 20,000. But I guess the person is asking how we're able to screen 20,000 women. So it's pretty easy when you carry the right people along. So we worked with the state government, we worked with the religious leaders, we worked with the community leaders, we had community mobilizers. In fact, the NGO that I worked with, for every community that we went to, the woman who is like the president of the NGO she's a chief in each of those communities. So she already made herself like a stakeholder in the community, and that made life a lot easier. And we had like dedicated health workers, especially the nurses, who were willing to like work on this screening for us. So it's easy when you talk to the right people, you have the right resources, and you have the right health workers to work with. It makes life a lot easy for you to be able to do so. Yes, we're able to do that. And nationwide, we have about 7 million women, young girls vaccinated.
Wow.
And yes, we do not have, yes, there were a lot of challenges. And let me shock you, majority of the challenges actually even came from southern Nigeria. for the vaccination,
Oh,
not Northern Nigeria.
okay.
Yes, they were rejecting the vaccine, saying that we want to make their girls promiscuous. We want to um, we want to stop them from giving birth, and quite a number of other things that people were saying. So the problem was even from Southern Nigeria this time around, not even Northern Nigeria.
Okay. So, Dr. Bapatune, since you've worked with so many of these women already, can you assure us, we are 61 on the call, about the safety of these vaccines, so that everybody on
So,
this call, like 61, that's a good number.
so I have personally administered 500 doses of the vaccine to people, personally, 500 doses, and nobody came down with any issues as we speak. Nobody has reached out to me and said they have any issues from the vaccines that they took, 500 doses. And 7 million doses, I will repeat again, of that vaccine was delivered between 2023 and 2024. So
Okay.
nobody came down with any serious adverse events following immunization. So it's safe, effective, and reliable.
Thank you very much for that. I think that is calming a lot of people. We have a lot of questions here. There's a question about from Marcella asking about how often can one do the pap smear? Doc, can you unmute yourself? Yeah, please.
Yeah. So I mentioned during the presentation that it's every 3 years. And for HPV DNA testing is every 5 years. And for those who are living with HIV or have other immunocompromised states, it's every 2 years or every year or yearly as it is prescribed by their doctors.
Okay. So is there a time when you stop?
Yes, you stop when you are 65 or when you have 3 consecutive negative results.
Okay, thank you very much for that. So moving on to the next question. How can we convince the overly spiritual people that are against the vaccinations to get themselves and their children vaccinated?
You become spiritual too.
That's a
Yes,
good one. I think you already answered this by saying you go along with spiritual, religious leaders. Yes. So when they
exactly.
see their pastors talking about it, yeah.
So
Okay.
I'm a Christian, and every time I talk about medicine in church, I I quote scriptures for people to know that this is from God. Because the first thing you need to explain to them is medicine itself, it's a miracle.
True.
Just imagine how big cancer is, and then you are saying just a vaccine can prevent you from having cancer. Is it not a miracle? And so you need to let them know that all good and perfect gifts come from God. And it's also, is there no balm in Gilead? Are there no physicians there? I also tell them that there's one book in the Bible that is written by, what's it called? That is written by a pastor. There's written by a doctor. That is the book of Luke. And when you look at it,
Exactly.
Luke kind of like explains all the diseases in the Bible. So I can go on and on. So if you are an overtly spiritual person and you come to tell me that you should not take vaccine, then I'll quote the scriptures that support the taking of the vaccine for you. And then you cannot
Thank
be
you
more
very much
Catholic
for
than
that.
the Pope. Yeah, you're welcome.
Thank you for that response. I think all good and perfect gift, truly. So someone is asking, Oladayo, please, what are the causes of cervical cancer? And maybe we could just take two at once. What are the causes of cervical cancer? And can a woman that is not sexually active have cervical cancer?
So I mentioned in the presentation also that 99% of cases of cervical cancer is caused by persistent HPV infection. That's a human papillomavirus infection, persistent HPV infection. And what are the risk factors? Probably that's what the person wants to ask. Smoking is a risk factor. Multiple sexual partners is a risk factor. Multiparity is a risk factor, which really makes sense because the more children you have, the more sex you have, the more sex you have, the more exposed you are to the virus. Family history is not a risk factor for cervical cancer. It is not. What else? So I think those are the risk factors for cervical cancer that I can remove. Okay, yes, long-term use of oral contraceptives. Those who use oral contraceptives for more than 10 years is also a risk factor for cervical cancer. So yeah, those are the risk factors. But every risk factor still comes down to persistent HPV infection. Persistence in the HPV infection is still one thing that comes down from it. The second question, can you remind me, please?
The second question was, can somebody that is not sexually active have cervical cancer? Can you hear me, Dr. Robertson? Oh.
Okay, I'm with you. Can you hear me?
Yes, I can hear you now. The second question was if someone who is not sexually active can have cervical cancer.
There's no never in medicine, but it's quite unlikely. And then a lot of people do things that they don't think is sex, but it's sex when it comes to cervical cancer. So when you dry hump, like I mentioned, the virus is found on the skin and the mucosal membrane, not in the semen and body fluids. So some people will just do just the tip. They will dry hump, rub genitalia against one another. It can cause cervical cancer. Some people will say, I've never had sex before, but you're sharing sex toy with somebody. You can have cervical cancer by doing that. So there's no never in medicine. So it's rare for you to see somebody who has never had any sexual contact to have cervical cancer. But the point, something that we left alone to say that, okay, HPV does not cause, can actually be caused by.
Okay. Can you hear me now? Sorry.
Yes, I can. I can.
Okay. So I think we'll take 2 more questions and then we'll have our post quiz. We have one here saying that she once heard that somebody bled to death after doing a pap smear. So how risky or safe is the pap smear test? And if you advise married women that have done the pap smear and it's negative to take the vaccine?
Wow, it's actually quite new to me to hear that somebody did pap smear and then died after pap smear. Probably the person had a bleeding disorder before. It's very highly unlikely. My organization has screened 8,600 plus women, and we've never had anybody bleed during the screening. So maybe
so
the person had a
rare
bleeding
complication.
disorder. It's not a complication.
Okay.
I dare say it's not a complication of cervical cancer screening. It's not. Probably there was something else that happened to the person and that led to that. You said something about married women.
Yes, the question was if a married woman that has done the pap smear routinely and it's negative can take the vaccine. I think maybe you could just clarify if women over 15 years could take the vaccine.
Again, I mentioned in my presentation that people between the ages of 9 and 45 can actually take the vaccine. So if you're above 45, you might decide not to take the vaccine again. but the vaccine is most effective between the ages of 9 and 14. Why is this? It's assumed that girls within this age group have not been sexually active and they have not come in contact with the virus. So the virus is only very active in people who have, and the vaccine is only active in people who have not come in contact with the virus. Because if you've come into contact with the virus, then you don't need the vaccine anymore. And your body automatically clears the virus when it comes into your body. But in 10% of people, the virus never goes away. So that's the reason why we just want to use the two-factor authenticator to ensure that we check and know what's happening. A lot of people will say when you do your screening and you're negative, take the vaccine. Screening does not determine whether you should take the vaccine or not. They are two independent things. Whether you are whether you are negative from the from the screening, or you are not negative from the screening, you can still take the virus. So let's assume that it's maybe type 18 that is causing it. You can take the vaccine and then it prevents you from type 16 or type 42 or type 45. You understand? So it does not stop you from actually taking the vaccine. There are two mutually exclusive activities that should actually be done.
Thank you so much. That's really helpful. Thank you everyone for the questions, for engaging. I see that it was really, really, really an important topic for us. And we've learned a lot. So can we just have our post-test, our post-quiz? It's not a test, it's just for us to show that we've learned something, knowledge gained. That's just what we're assessing. We're not going to send your scores anywhere. So I think the post quiz is up now. Please just confirm that you can see it and we can start taking the post quiz now. Even if you were unable to take the pre-test, please, you should still take the post quiz. Okay. Oladayo is saying that they can't see it. So you go to more on your laptop, look down, the icons down, there is one written more. When you click on it, you'll see polls and quizzes. You click on it and it will show up. Okay? Please confirm that you have been able to do that. Okay, I see some people have started already. That's great. Let's keep it coming. There are just 8 questions, right? I see there are some people that are attending like in a group. You all can decide and take the test together. Okay, more people are taking the quiz. Great, great, great. Please, let's get the responses coming in. If you're unable to see the quiz, if you're having any difficulties, just write in the chat and somebody is going to help you out. If you're just coming in, I see some people dropping off and coming back in, please take the post quiz. Akinwale, can you attend to Oladayo? He's having some challenges. Thank you, everyone that is taking it. That's great. Please keep it coming. Please, everyone should endeavor to take it. It's just to assess that we We understood what the doctor has presented. We'll have some time to go over it again so that we can clarify everything. Thank you very much. I see quite a number of people that have taken it. Please, let's keep it coming. We have just 8 questions. Please don't hesitate to take the post quiz because maybe you were unable to take the initial one. Everybody should try to take the post quiz, should take the post quiz. Okay. If you're having any challenges taking the quiz, please indicate in the chat so that someone can help you. Thank you so much. Please, everyone should try to take the post quiz. Please indicate if you're having any challenges. If you're having maybe network challenges, you can drop off and try to join back in, or you refresh your network so that you'll be able to take the quiz. If you can't see it on your screen, go to more, click on it, and then click on pop quiz, and it will come up. The Matador team still cannot access the quiz. Can you drop off and try to reconnect? Okay. Are there other people that are facing challenges with taking the quiz? Please do not hesitate to take the quiz. We need everyone to take the quiz, please. If you didn't take the pre, you can still take the post. This is just for us to access knowledge gain. We're not going to send your scores anywhere. Please, if you're having challenges taking the quiz, please. We're trying to sort out for others that have not been able. If you're having network issues, you could drop off and reconnect and then try again. Is there anyone that has been unable to take the quiz because it's not popping on their screen? Please, any challenges you put in the chat. Okay, we have just some few seconds now to round up this session so that we can discuss. Please keep your answers coming. Okay, so we'll be rounding up in the next 30 seconds. Please, if you haven't taken the quiz yet, just quickly take the quiz. We have just 8 questions. Just quickly take the quiz before we round up this session. Okay, we'll be ending these sessions in the next 8 seconds. Thank you so much for taking the quiz. Thank you for everybody that was able to do that. So we're just going to go on now to the next slide, please. Can we go to the next slide, please? Okay. So Dr. Babatunde will need you here to help us with the answers to our quiz so that we could learn again another session of learning. Can we put up the quiz questions so that we can go over them again quickly? Okay, so the first question we had was, which major challenges limit the effectiveness of cervical cancer screening in Nigeria? And it was a single choice question. We had overcrowding in hospital, limited screening centers, too many screening programs causing confusion, high government intervention rates.
Also, it's the limited screening centers. We do not have enough screening programs, even causing confusion. So it's the limited screening centers. That's the answer.
Thank you very much. And I would say 97% of us had that. So that was really great. So what is the primary cause of cervical cancer? We have bacterial infection, persistent infection with high risk HPV, excessive sugar consumption, exposure to radiation.
Persistent HPV infection.
Thank you. Just to clarify, HPV is a
human
virus,
papilloma
right?
virus. Yes, human papilloma virus.
Thank you very much. So most of the participants had that too, which is really great, meaning that we're listening. Thank you so much. Then which of the following is not a level of cervical cancer prevention? We have primary prevention, secondary prevention, quaternary prevention, and tertiary prevention.
That's a little tricky, but quaternary was not one of the ones we discussed, so quaternary prevention.
Exactly. So we talked about primary, secondary, and tertiary, and most of the participants had that correct too. So the food was, what is the primary method of prevention of cervical cancer? We have regular pap smears, HPV vaccination, avoiding sexual activity, early detection through regular checkups.
HPV prevention, HPV vaccination.
Thank you. So this one was a bit tricky. Most people had it though, but some people were maybe confused with early detection through regular checkups. But this is a primary method of prevention, which is vaccination. Okay, and the fifth, secondary screening for prevention of cervical cancer includes HPV status, safe sex education, and health education. True or false?
So the HPV status is correct because that is like you're doing HPV DNA, but safe
Mhm.
sex and education is they are all primary prevention, so it makes it wrong.
Okay. Thank you very much for that. So we have what are the early signs of cervical cancer? We have no symptoms, abdominal bloating, difficulty getting pregnant, missed menstrual periods.
So at the early stages, cervical cancer does not actually have a symptom.
Okay, so no
Yes.
symptoms, and most people had that too, correct? So I think we should be clapping for ourselves in the clapping the reaction area. So what is the following, which of the following is a symptom of cervical cancer? We have weight loss, fatigue, abdominal distension, abnormal vaginal bleeding, joint pain.
All of them are symptoms, but it usually starts with the abnormal vaginal bleeding.
Yes. So would have said like the measure. So
Yeah.
most people also had that. So great. And the last, other than HPV, what are the risk factors for developing cervical cancer? We have smoking, weak immune system, family history of cervical cancer, all of the above.
So this is tricky. Family history of cervical cancer is not a risk factor.
Mm-hmm.
Cancer. So me, I would go for family history. Every other one there is a risk factor for cervical cancer, except family history. We talk about family history when we talk about breast cancer, not in cervical cancer.
Okay. Thank you very much. Thank you so much, Dr. Babatine. It has really been an excellent learning time with you. Thank you so much for your time. Thank you for this for the education and for all that you do. I would like us to just express our gratitude for Dr. Babatunde for giving us his time, for taking out time from his busy schedule to come and educate us on cervical cancer. Please just emojis, anything in the chat, just saying your thank yous and how you feel about the session. Thank you, everyone. Thank you. Thank you so Okay, so we just want you to quickly take this survey. It's a reaction survey to just tell us how you felt about this training. What were the expectations you came with? Were your expectations met? How were the materials present? Were the materials helpful? Please, I see many people are making a lot of noise in the comment section. Thank you so much. Just take the quick survey. We have just 5 questions there, just to let us know. Thank you so much. I see. Thank you for taking the survey. Thank you. Please just keep your reactions coming in. Your reactions about the whole session. Was it helpful? Was it necessary? Did it meet a need? Please just have your reactions coming in. Thank you. I see people writing in the chat that it was helpful. Please remember to take the reaction survey. Thank you very much. Eye-opening and very needful. Thank you very much for the reactions. We also have a link to the Quinta Foundation, to the Quinta Health, sorry. Please, you can go use the link, read more about what they do so that you can be able to benefit from their services. You can recommend somebody to the services. You have that in the chat. Thank you, Abigail. Abigail says it was very brief and self-explanatory. Thank you for that feedback. Please remember to take the reaction survey. Very impactful. That's from Patience. Thank you very much, Patience. Please keep the reaction surveys coming in. There are just 5 questions. You quickly click and then. Thank you, Marcella. Marcella says it was very educative. Thank you so much. Please keep the reactions, so keep the answers coming into the reaction survey, please. I hope everybody can access it.
It's not opening from my end. Reaction survey.
Okay. So, Akinwale, can you address patients' challenge in the chat? Dr. Babatunde, somebody is asking you to come to Ghana. Ghana needs this too.
No problem. If they can sponsor me, I'll come.
Okay. Thank you very much.
Reaction survey not opening.
Are you able to see the reaction survey now?
No, ma, I've not.
Can you maybe are you using your phone? If you're using your phone,
Okay. I think I can.
please go to more and then you click on it. You go to the polls and quizzes. You'll see that there. Okay. So we'll be rounding up this session in the next 10 seconds. Okay. So thank you so much, everyone. You people have been so amazing. We are MDoc and we are all over social media. And if you are not yet following us on Facebook, Instagram, Twitter, YouTube, LinkedIn, you can follow us using these handles and see the work that we are doing and see how you can also benefit and participate in that work. Next slide, please. So we're going to be putting our social media handles in the chat so you can get to it. And if you've not downloaded our Complete Health app, you can do that so that you can have your health in your hands. You see how you can benefit from it. Everybody can benefit from the Complete Health app. So just follow our website and you'll be able to access all of this. Thank you for coming. We are so grateful. Thank you, Dr. Babatunde, for this session. Thank you, everyone. I think everybody deserves an applause. So we have come to the end of our session. Thank you all for coming. Thank you. Thank you, everyone.